Good morning and welcome to the 25th edition of our COVID-19 Talk with Local Health Authorities. It's sponsored by the Rotary Club of Houston. With me I have Dr. David Persse representing the City of Houston, Dr. Umair Shah representing Harris County. This is sponsored by Rotary Club of Houston. I'm Stephen Williams, the Director of the Houston Health Department. I want to give a special shout out to past President Kathy Finninger, who orchestrates these questions through the Rotary Club of Houston. First question. Can you advise about flying in a plane for a 3-hour flight in light of a CDC study that shows the spread of the virus in a plane where all wore N95 masks in a controlled experiment? Have y'all heard about that?
I haven't.
I thought I heard about something a while back, but I don't remember what it said.
I haven't heard about, yeah. I mean, I think first of all, great job on the color coordination of shirts and pants today. We did not call each other this morning to coordinate that. But related to this, I would say that we continue to say that when you're on a flight to wear masks, and that's critical throughout. And we want to also emphasize something that, David, you and I have been talking about, which is this sort of eating, drinking piece. A lot of folks are using that as time off from wearing a mask. And, you know, we want to we understand everybody's tired of wearing these things. Everybody is tired of wearing these things. But it's when you're actively eating or drinking. In other words, if you've got something in your mouth, you know, you're about to sip something, you're about to put something, yeah, pull the mask down. That doesn't mean you take the mask down for the entire hour that you are on the flight or in another setting like a restaurant, and you keep it off the entire time, especially if you're around others, because that's when you are going to get exposed. So do not play chances or, you know, give this sort of virus the ability to spread because you said, yeah, well, I just took the time off because I'm eating and drinking. This is really about your own protection.
You're most exposed when you're not covered up.
That's right.
Actually, I had to be reminded of that last week. One of my staff people, I told him I was going to meet somebody somewhere, and I said, why are you doing that? You know that's not really that safe. Yeah. And I said, oh, you're right. So I changed my plans. Since the guidance is to stay 6 feet apart, what can we do about at least getting airlines to keep the center seats open indefinitely? I found out firsthand that all airlines are not being as proactive as Southwest.
Yeah. Yeah, and it's buyer beware, I think. You need to ask when you make your reservations, and if you go through a travel agent or if you do it online, you may not get the answer, but if you can get to somebody at the airline and ask them what their policies are, and they should be posted on the web. I haven't traveled in 8 months, so I don't know, but it's a little bit of buyer beware. You need to make sure they are taking precautions.
Yeah.
And I guess if enough people go to one airline that's doing some, keeping the center seat free, then other airlines might modify their policies.
Right. The Montgomery County judge believes 99% of those who test positive survive and says whenever we do that number does not change. He believes we should reopen businesses at 100%. 99% of those who test positive survive.
Well, so that goes to case fatality rate. And actually, the case fatality rate, the number of people who die or tested, I do not believe it's 99.9 or 0.01%, as he's saying. I haven't looked at it lately, but at one point it was as much as 2%, right? And so case fatality rate is a little bit different than death per capita, and you get all of these statistics. The bottom line is a very well done study was done from Harvard and Yale University School of Public Health looking at the New York City incident, found that the COVID virus in New York City was 24 times, actually a little bit more than 24 times more lethal than the common flu. So it's, you can look at these statistics, you can split it every way you want. Bottom line is this flu kills people. We've got over 900 Houstonians that have died in the last 6 months, actually last, 5 months? 900, all right? And I personally know 3 of them.
Yeah.
Because I worked with them at the fire department. Yeah. And well, 2 in the fire department. We've had 3 deaths in the fire department, 2 of them who I knew, and 1 other person I know who died, and they're dead because of this virus. So I completely disagree with the Montgomery County. Just respect them, but I completely disagree.
Well, where I would go is that, look, we're 180 plus thousand deaths across the country, and this is after all the efforts and all the activities that we curtailed in order to prevent deaths and really adverse outcomes, because it's not just about deaths, right? It's also about somebody who can have complications, and we're knowing post-virus that people for months and maybe even longer still have symptoms or some lingering complications. And so, this is really about the fact that, what would have happened, and we keep saying this in public health, right? What would have happened if we hadn't taken those steps? Would that 200,000 close to deaths would have been 250,000, 300,000, 350,000? So yeah, I think it's easy to do a retrospective look back and say, okay, well, it's not so bad, let's open up. But the problem is you don't know then till several weeks later if that's the wrong decision. And we, from a public health standpoint, don't want to take that risk.
And I want to add one other thing. So President Bush, second President Bush, he said something that has always stuck with me. He said that when somebody dies, that's a tragedy.
Yes.
But a statistic, a bunch of numbers of people dying, that's just a statistic. And so we need to not lose the fact. So to bring it back, make it a little bit more personal, the two Houston firefighters, Paramedic Pacheco and Captain Persse, they left behind families. These were actively working firefighters. These are not old people in a nursing home who somebody can say, well, they were going to die anyways. These people were not going to die anyways. They had families. Captain Persse leaves behind children, So I'm sorry, but I completely disagree with that notion that this is just the flu or anything along those lines.
One of the epidemiologists Sir Bradford Hill, that we talk about, said that statistics are numbers with the tears wiped off. So just a reminder that it's really about not just numbers, it's about the people that those numbers represent.
Yes, every day we publish a report and the demographics of the people who died, not necessarily that day, but the reported deaths on that day. And I always look down to really explore them a little bit closer. It makes it more personal.
Yeah.
The governor just renewed the disaster declaration again. Have any of the rules changed? The city of Austin extended stay home, wear mask orders until December the 15th. What about Houston? Is the rule about wearing masks until the county has less than 20 cases? 20 cases?
I haven't heard the 20 cases. Yeah. But I will say that the disaster declaration that Judge Hidalgo has signed is now 2 weeks beyond the declaration for the governor. So that means it doesn't have to go to Commissioner's Court every so often. It extends automatically for 2 weeks beyond that. And the governor's declaration, I believe, is just an extension of. I don't believe that there are any additional.
There's no expiration date. Yeah.
Yeah, and there are no additional restrictions or permissions. Although there has been now, as you've seen in media reports, of some easing out of some of those sectors, for example, in restaurants or businesses that have been discussed. Now, whether that comes to fruition, we're waiting to see.
I haven't seen that.
This whole issue about wearing masks, I think people are waiting on an end date, and we've talked about this before. There's probably no end date in the immediate future.
No.
That's right. Get your favorite mask, your favorite colors, your favorite designs, because you're going to have them for a while.
I'm still looking for a mask that'll match my tie. And when somebody starts coming out with those, I think they're going to sell like hotcakes.
David, I have several masks that are in my briefcase and backpack, and you just show me the tie, I probably could match it. You've been joining the COVID-19 talk with local health authorities. We'll be right back.
We are in this together now. Now we have the tools to overcome this challenge. Social distance, wash your hands, get tested, and wear a mask. And we will. I have no doubts. Because I believe in we. Better together.
Hello, Houston. Now more than ever, communication with our neighbors is critical as we work together to prevent the spread of COVID-19. It's important to get updates about resources, testing, and safety practices. Sign up for neighborhood updates to receive automated voice and text messages in English and Spanish. This new resource is available for anyone interested in receiving messages without needing a smartphone or access to the internet, especially our seniors. To subscribe to neighborhood updates, call 311 today and enroll.
Welcome back to our COVID-19 talk with local health authorities. Early thought was the virus is less likely to survive and be transmitted in warmer climates. Has any study looked at this recently?
Recently, I don't know, but now when the weather changed, there was a study came out that showed that the R naught came down a little bit. I think it came down from like 2.4 to 2.0, which is clinically insignificant.
Right, that's what I was going to say. Statistically significant is different than just having a decrease. But no new studies that I'm aware of, but also, unfortunately, we haven't seen this change much. Now, we have started to see some welcoming numbers. Again, we don't know if it's because people aren't being tested as much or what, but at least the positivity rate is coming down, which is good news, but we don't know if that has anything to do with weather or just change in behaviors.
Well, actually, the weather's about to start changing in the wrong direction, right?
Yeah, we'll
this
see
cold
what
front
happens.
dropping it down to the low 90s.
Yeah.
Well, coming to work today, it was in the 80s, so, and it was raining. Kind of in the same vein, are you expecting a pre-flu season spike as schools reopen?
So I'm bracing for it. I don't know about if expecting is the right word, but I'm bracing for it. That's our job, is to be prepared for that. So I'm bracing for it. And if I had to make a prediction, I think that what we're going to find is that it won't be uniform across all school districts or all school campuses, but I do fear that we're going to get some campuses where we're going to get the numbers popping up.
Yeah, I'm worried about it. I mean, you know, but whether it's anticipating or expecting, I don't know, but just worried that we are going to see some increases. We just don't know how much, and we also don't know where, and that's the other piece that's concerning.
And you're also talking about potentially affecting a population that has not been impacted as much.
Right. And can I say one other thing? You know, based on our experience with nursing homes, I think that the success, if you will, of schools to be able to keep the virus down is going to be directly related to the safety procedures they have in place. Because we found that within the nursing homes that we went out, before we went out there, you know, everybody had tried starting some things, and some had done a really good job, and they actually had relatively low numbers. Others had done what they thought was a good job, but as it turned out, it really wasn't such a great job. No fault of their own, they just didn't understand, and they had some issues. And then we had other nursing homes which, you know, were completely asleep at the wheel, and they had terrible numbers. So there was a direct correlation, and I anticipate that we may see the same thing with schools. So I really encourage the parents, the teachers, the school administrators to get serious about it, because I think you can have a really positive impact if you stick to it.
That sounds hopeful.
Try to be.
I know it's still early, but any impact yet from Labor Day weekend?
It's too early.
It's too early.
It's too early. What are we waiting on, next week?
So we generally say, you know, 2 to 3 weeks post-holiday. So, you know, again, it was just Monday, so, you know, not this coming Monday, it'll start the following Monday into the following, you know, week after that.
No, and here's the other thing, though. If people don't go and get tested,
We won't know.
we won't know. It'll be going up, and we won't know. We'll know eventually, but we'll know when the hospitalization numbers start going up, and that's really too late.
That's right. That's right.
Okay. Masks, lots of questions this week. That was actually Kathy's comment. Recent study found that neck gaithers aren't as safe as originally thought. That seemed to be the face covering of choice of people running and walking outside. Will there be any specific regulations about the type of mask? What are city officials doing with this new study information?
Yeah. So I'll say two things about it. One is that comes from a study that was actually a pretty well done study, but the study was about how to measure the effectiveness of a mask. And then they found in that it appeared that the neck gaiters didn't do such a great job. But the authors were very specific in pointing out that they weren't looking to measure one mask's efficacy versus another. They were looking at the testing modality. So I think that with a grain of salt, and it makes perfect sense. If you're wearing a neck gaiter, these are the things that go around your neck and you just slide them up, right? If they're single layer thickness, which most of those are, the finding in that study shouldn't surprise anyone. But the authors point out that's not what they were testing for. So what we really need to do is we need to now do a formal test comparing different masks. And I wouldn't be surprised if we find the same thing, but just that little asterisk that study wasn't designed to look for that finding. Nevertheless, you won't find me wearing one.
Well, the thing I would say is that one of the real concerns that the three of us have, and I know we've all talked about it, is people improperly wearing a mask, right? And so you're seeing folks, the mask is on, the nose is not covered. And we want to remind everybody that the nose, maybe people think because the mouth is a bigger orifice and you get more interaction of air exchange or what have you when you're, et cetera, but the nose is absolutely an entry point for virus. And so if you do not have your nose covered meticulously all the time, you are essentially putting yourself at risk. And so a gator, you know, the challenge is that it comes from the lower part of your neck up. And so a lot of times what's also happening is people aren't going all the way up, and they're doing it without masks. They're not doing it the same way. And we just want to make sure that people are not just wearing masks because they're required to or because they think that, but that they're properly doing it. Because this isn't just about for show or because someone is saying you must do it. This is because we're actually thinking this is the best way to protect yourself from a virus that, by the way, can still be harmful. And that's the key message, and I think people are forgetting that.
One thing that's coming up that I think is related to this that's important, and there is a study that recently came out, and you got a copy of it too from Dr. Septimus, looking at the face shields with the absence of a mask. And those appear to be highly ineffective.
That's right.
And it shouldn't be a surprise to anyone. But for the folks who don't like wearing the mask, so they've gone to wearing the face shields only, they need to understand that is almost worthless.
That's right.
It doesn't protect you. It doesn't protect the people around you. It is nearly worthless. So
that's right.
That's probably a bigger problem.
Yeah.
You've just answered the next question, which was, does a surgical mask that is relatively loose and flimsy really protect the wearer? No.
And the other thing, remember, so we've had this conversation. Some of these questions are based on, that last one is based on the ability of the mask to protect the wearer. And if you remember, the majority of the protection isn't, but not all, majority of the protection isn't to the wearer, it's to the people around you. In case you're infected, it really limits your ability to spread. But there is some recent studies out that show that it does in fact help protect the person who's wearing it, which in the beginning we weren't really too confident of.
That's right.
But it does provide some protection to the wearer, still mostly to the people around you. But yeah, if you want to protect yourself, don't wear a face shield and don't wear it up over your lips and not your nose, because you're not protecting yourself.
That's right.
Absolutely.
That's right.
If one mask is good, can wearing two masks be twice as good, or should we put filters inside it?
Well, you know, I think the thing is, and in fact, the study you were talking about with the comparison of different masks, they did talk about the thicker it is that individuals have a face covering, and they looked at different face coverings, that you start to get the other piece, which you want to be careful of, which is when it's too thick, people start to say, I can't really breathe very well in this, and then they don't wear it universally or all the time. And so that then you have to balance. So yeah, if you could wear two, you could wear three, fantastic. But there comes a point where it's a law of diminishing returns. You're not going to get that much bang for the buck in improvement, but you're also going to get the discomfort, and then people might decide, I'm not going to wear one.
So I'm going to make a confession.
Uh-oh.
So I've had to go to some places, I won't say where, I had to go to some places where I wasn't entirely comfortable with their processes. So I wore an N95, but I didn't want to insult them. So I wore another mask over it. And you know what? I was able to breathe just fine.
Thank you for joining our COVID-19 talk with local health authorities. We'll be right back.
Hi, I'm Simone Biles. Mask up like a champ to protect yourself and everyone else.
As we reopen our city, it's important that we do it safely. Continue to wear your mask in public.
Wear it like a champ.
Mask up, Houston.
We are in this together now. There can't be a they any longer. It is we that has endured every major challenge in history. Now we have the tools to overcome this challenge. Social distance, wash your hands, get tested, and wear a mask. It's time for all of us to become we and look out for each other. I have no doubts, because I believe in we. Better together.
Houston hay que hacer mejor y la única manera de hacerlo es juntos. Hay que ser consistentes en practicar distancia. Desinféctense para salvar vidas. Hay que ser mejor y hacernos la prueba. Esta pandemia solo puede terminar si trabajamos juntos.
At a time when kids may be confused by an invisible villain, there's an elite group helping them understand and be safe. They're fighting what's out there by staying in here. They are the Stay Heroes. Meet the Great Hygiene, expert at washing hands and disinfecting surfaces and objects. Dr. Distancio is a master of physical distancing and virtual playdates. And General Fields uncovers emotions and harnesses positivity. Your kids can become Stay Heroes too. Learn how at stayheroes.org.
Welcome back to COVID-19 Talk with local health authorities. I have a stack of questions here. Assuming a vaccine is developed for COVID-19, what risk do we still have from mutation of the same virus reaffecting vaccinated people?
Well, first of all, too early to tell because we don't know how the vaccines are all going to play out. Number two is that if it's a little bit of a change, then it should be okay. But if it's a lot of a change, then obviously vaccines would potentially be not as efficacious or effective.
Emergency use authorization has a lower standard for approval. What do you think of Operation Warp Speed?
Well, I think it's well intended, and the proof will be in the pudding. So if they push it beyond the safety standards, then we're going to have a problem. But right now, so the manufacturers of 9, I think, pharmaceutical companies came out and said they're not going to cut any standards, and so that's what needs to happen. At the end of the day, kind of what I said a little bit earlier is that we need to listen to the science. And you know, if there is a vaccine that comes out that's being pushed, and the medical society or the scientific society says that's hadn't met the standards, then buyer beware.
I hear you.
Yeah, I was just going to say Millennium Falcon. Whenever I think of warp speed, I think of going fast, but it's also about the quality of the warp speed. So you want to get to the end, end result, which is to have an effective quality product at the end of the day.
UC San Francisco identified an antibody, a synthetic antibody that can block COVID as a bridge to treat patients until a vaccine is approved. Please explain how this works.
I'm not familiar
with that. Yeah.
Unless
the monoclonal antibody, I'm not familiar.
Perhaps.
We'll have to look that one up.
When a vaccine is developed, will schools require students to take it along with other required shots?
Well, that'll be a question for the legislature, I think.
Yeah.
Mm-hmm.
I've seen so many announcements looking for clinical trial volunteers. How safe are they?
Well, again, when you are doing safety trials, they are trials, and so there could be adverse outcomes, and we just don't know. But there are safeguards that they try to put in for those participants. Again, I do want to encourage people to participate in those trials because that's how we can help protect the larger population of everyone else. But yeah, there are risks to those that also have to be.
Part of the point is they're trying to determine the level of risk. So the risk is low, or they wouldn't have gotten to that point, but it's not zero.
Right.
You referred to this earlier. 9 pharma CEOs signed a pledge that they will hold to the strictest guidelines. What organization will monitor them?
Yeah, so that's where the FDA is supposed to monitor them, quite honestly. That's the answer to the question, the FDA.
Yeah, there is I think I'd mentioned there is a society for the what was it, the regulation professionals, some industry, and that is very similar. Like we have the National Association of County City Health Officials. It's an umbrella group, and they're also looking at some independent ways. And the National Academies of Sciences, Engineering, and Medicine has also been a part of it. But you're right, it's the FDA at the end of the day.
Given some misinformation recently, do you still trust the CDC?
David, I'll let you answer that one first.
So it pains me to say, but really up until just these last couple of events, I totally trusted the CDC. But now I'm paying close attention to what comes out of the CDC as whether or not I will support it. And can I just say, that from a public, that is tragic.
It is horrible.
It is tragic.
It is horrible. It really is. Yeah. And I agree with you. I've been disappointed by some of those pronouncements that have come out that do not feel that they are medical or health or public health, but it feels like it's been politicized.
AstraZeneca, Oxford University, paused their clinical trials when one patient came down with transverse myelitis.
Transverse myelitis.
Transverse. Oh, I did read that wrong. How long is the pause, and how can they absolutely confirm that it has nothing to do with the trial?
Yeah.
They said it was still going on, though. Go ahead.
Yeah, so those are great questions. They will decide how long they're going to pause it for. They're going to investigate this case. And because it's one case, it's going to be, you know, I leave it to them, to the scientists who are professionals in a area that I am not a professional in, to try and figure out, you know, what is the likelihood that this one complication was due to the vaccine, or it was, because transverse myelitis, it happens. People get it, right? It's rare, but it happens. So is this just somebody who just happened to get it? Is it a coincidence?
Do you want to describe what transverse myelitis is?
I'll let you do that.
Quickly, if you're going to do it quickly.
Yeah, inflammation around the spinal cord, and so it can actually have neurologic effects, and sometimes can be significantly severe.
Because it's distal paralysis.
That's right, that's right.
Okay, with 9 vaccines in final stage of trial and 1 on hold, if one is approved early, people will fear. If it takes too long, the damage will worsen. Realistically, what do you anticipate? Actually, AstraZeneca said with their drug, they're still targeting 2020.
Okay.
Are you, at what point will you be willing to take a vaccine? Good question.
Yeah, so if there's a well-done phase 3 trial that has the results that we hope for, I'll take that vaccine, but not without a well-done phase 3 trial.
Yeah, I would say when it's safe.
What have you heard about
effective.
What have you heard about stem cells used to treat COVID? I cut you off, Shah, personally, intentionally. What have you heard about stem cell used to treat COVID?
I've not.
I have not.
The FDA says that non-steroidal anti-inflammatory drugs, such as ibuprofen, are not linked to complications for severe coronavirus disease. If taken regularly for arthritis, would it help?
So there was some concern about the non-steroidals worsening coronavirus, but that got determined to not be accurate. So yeah, if you're taking it for your arthritis, you should be able to take it.
In layman's terms, how does surveillance testing work?
So surveillance testing, this is what we're doing now. So we're going to go out and the CDC has randomly selected homes through an algorithm that they have. They'll give a cross-representation of the city, and they're going to go out and we're going to test people for antibodies, see if they've been tested, or they've been infected in the past. And so really, when we talk about prevalence, it's trying to, so there's biases with the testing sites, there's biases with the hospitals. This is a way to eliminate that bias, to find out what the prevalence is within the community.
Okay, what is the connection with Houston Health Department antibody testing survey? What are our rights and responsibilities? When you say resident will be randomly visited, who does the randomization? I'll answer that. Basically, that was done by UT, Rice, and Baylor. And actually, it's voluntary. It's not
voluntary,
mandatory.
right.
But it's very important, so I want to underscore the importance of that kind of work.
Yeah.
Can you discuss COVID-19 self-check assessment from Texas Health Trace?
Nope, I don't know that.
I know that there is no requirement for colleges to publicly post their statistics, but are they being encouraged to do so in Houston?
Yeah, so if they're
report
positive
those.
cases, it's reportable. They have to report those.
Right.
Yeah.
What is the mortality rate for most vulnerable over 65 population, and what percentage is that population of total deaths versus all age groups? Do we know?
I don't have a number for you, but we can get it.
Yeah, I would just say that obviously those that are they're more vulnerable, the older, and
Comorbidities.
Right, morbidities and disproportionately impacted communities. That's a significant driver of the increase in deaths as well as increase in hospitalizations.
Thank you for joining us for COVID-19 Talk with local health authorities. With me was Dr. David Persse, representing the City of Houston, Dr. Umair Shah, representing Harris County. I want to thank you to past President Kathy Finninger of the Houston Rotary Club. I'm Stephen Williams, the Director of the Houston Health Department. Thank you.